Hi guys, so today we're going to talk about women's health in the lesbian, gay, bisexual, and transgender community. So as most of you know, we had that tragic incident in Orlando last week, so I wanted to talk about something that was related, and since I am not an expert in guns or I'm not a politician and I really can't influence much, I figured that I would talk about women's health in the LGBT community since no one really talks about that. So there's this misconception that women in the LGBT community really don't have to see the GYN as often because of course they don't need birth control, or maybe they think that they're not exposed to sexually transmitted infections as much as women who have intercourse with men. But that's not exactly true. So we're going to talk about cancer screening, when and what type of birth control you should use, what sexually transmitted infections you're more vulnerable to, other medical problems that are more prevalent in the LGBT community. Cervical cancer is more prevalent because women tend to not go to the GYN as often and they don't get screening as often. And so that makes women more vulnerable to having the diagnosis and not being treated early enough. Also, breast cancer, it might be due to the fact that lesbian women just don't have children, and that has a protective effect, or maybe they don't go on birth control, and that also has a protective effect to breast cancer. So 1 out of 3 women in the lesbian community will have breast cancer, as opposed to the general population, 1 out of 8. So for HIV and AIDS, all women who test positive for any sexually transmitted infection should be offered HIV testing as well, and otherwise we recommend an annual testing for those who are at high risk of sexually transmitted infections. So the risk of infection varies depending on women's sexual orientation, on the number of partners or specific sexual practices, but it should be offered to all women. Women in the LGBT community can acquire a sexually transmitted infection through finger to genital contact, or sharing sex toys that haven't been washed in between, or not using a condom on the sex toy, or genital to genital contact as well. Safe sex practices includes washing toys before they're shared, or covering a toy with a fresh condom, using a dental dam during oral sex, or latex barrier, or plastic wrap as a barrier as well. Also, someone who has tested positive for herpes, genital herpes, can offer Valtrex for their partners. And of course, we always encourage the use of Gardasil for HPV prevention. Also, the LGBT community is more prone to smoking and alcohol consumption, and as well as behavioral health or mental disorders because of the problems that they encounter from the community, and as well as domestic violence. And something else that is important is the topic of parenting. So check down below. I'm going to leave 2 websites that are good resources to get more information on how to become a parent. And of course, having a sperm donor is one option, getting a surrogate, having a baby from a heterosexual relationship, or conception through donor insemination, or just adoption. Also, obesity is more prevalent in the LGBT community, and of course that's associated with high blood pressure, diabetes, and cardiovascular disease. So I hope you guys like the video. Subscribe to the channel, you guys. Like us on Facebook and follow us on Twitter. I'll see you next week.